Lab before essay, got it. Okay. Um, that's actually kind of nice. That's actually kind of nice. So my general plan today, we'll talk about patho per usual. Got a practice exam for you guys to work on. We'll kind of work on it together. You'll see how it works. And then that should leave us some extra time. I'll give you some tips about ProctorU. Just remind me, give you guys some tips about ProctorU when you guys take your health assessment exam. And then we can do a primer for quarter 2 if anybody is interested about like what's going to go down there, what to expect, how to kind of prepare for that kind of. So that's what I kind of have on the menu. Okay. All right, so let's see. Oh, our schedules. I don't know. I haven't gotten mine yet. Hopefully it should be sometime this week. But just heads up about your schedule. It can still kind of change a little bit. What you're getting is a draft. The reason why it's a draft is because clinical placements can change depending on instructor availability and facility availability. So just heads up, even if when you guys do get your schedule sometime this week, just understand it's not finalized until the end of break. I know. When it comes to the schedule, it's kind of like Jesus take the wheel, in all honesty. Like it's way above my pay grade. I'm just gonna let them figure it out. All right, so talking about the final exam. Okay, so final exam is going to be tomorrow, 12.14. Now I have the classroom from 8 to 11. Ooh. From 8 to 11. Classroom F. So it's classroom F is excuse me, is downstairs in the basement there. I can't remember if we're usually in D. F is just right across the room there. Okay. Even though I have the class, the exam won't start till 9 in the morning. Okay. So if you want to arrive early, you're more than welcome. I'll be hanging out. I'm going to get there before 8, just to kind of make sure things are actually working and set up properly. So I'll hang out for any like last minute questions, pep talks, that kind of thing. But yeah, we won't start until 9. So if you don't get there till like 8:50, it's fine. In terms of the exam, there's kind of like 4 sections, if you will. You're looking at, let's see, endocrine, multiple choice, cumulative, multiple choice, cumulative. Wow, I botched that up. Short answer. Short answer. Holy cow. Sorry, my coffee did not nearly get done brewing. And then essays, there's 2 of them. 1 endo. And then 1 cumulative. Okay. So that's what you're going to be kind of looking at there. Questions about the final? 2 hours to take it. You don't need to use the full time if you don't want. Scrap sheets will be provided as well as earplugs if anybody wants them. So kind of standard. I'll be grading them as they come in. So hopefully you'll know your grade sooner rather than later. I will try to have final grades published later that afternoon too. Okay. All right. Kendall, it's going to be one of those. Nice try. Yeah, don't worry. Let me put it this way. With this practice exam, I got you either way. All right. So how this practice exam kind of works. Actually, let me just close this. How this is going to work. You know how in health assessment you guys use Kahoots? I hate Kahoots because it makes me overly competitive. I'm always trying to rush to be the first one, and I don't really read all the way. So I kind of do my, yeah. We'll see. So I do my final exam review a little bit differently. What's going to happen is you guys are going to need, I would say, probably a few scrap sheets of paper. No, Lita, it's not going to be the same amount. What I have for you guys is 40 questions. 40 questions. And the reason why you want other scrap sheet paper is because we're going to go through all of the questions and then we're going to go through the answers. So what I'm going to do is I'm going to treat this like a quote unquote exam where I'm going to make it a little bit more stressful. There's going to be a timer for each question. Depending on the complexity of the question, the more time you'll have, but generally anywhere between 30 seconds to a minute, maybe a minute and a half, maybe two. So what's going to happen is I want you to write your answers down on your piece of paper. We're going to go through 40 of them, and then we're going to go through the right answer. Does that kind of make sense? A, that way no one spoils it. B, you only have yourself to compete with. Kind of makes sense?
All of us up today to just see us cry real quick before we feel better.
Kind of. So with this practice exam, I'm not going to lie to you guys, I made this harder. I made this harder than the final exam. Why? Because I think if you train harder when it's time to perform, easy peasy. A couple of ways that I made it harder. There's no, I think there's only like 2 multiple choice questions. Everything is basically, you got to know the answer, you don't. But this creates a list for you of what you should probably brush up on. Does this kind of make sense? And the kind of like the details that I'm kind of looking for. So yeah, I'm trying to make it a little bit more stressful than not, but not excessively. Meredith, no, this will not be uploaded. Couple of things. A, I usually don't even record my final reviews, i.e. whatever notes you take, awesome, those are yours, but I usually don't post this. I probably will just because, hey, we're online and all that, but the standard for most reviews is nothing gets recorded, nothing gets written down, everything gets turned in at the end of the review. That's not really helpful to you guys. So that's why I decided to record this, and I'll still post it to YouTube. So that way, if you guys need to review questions or anything like that, you got it. But I probably won't be posting this here, the PDF version. So yeah, this is a 40 question exam. This is going to be a marathon. We'll do 20, take a break, and then we'll come back and do another 20. Okay. So I would say get your coffee ready, get your pens ready. Up to you if you want to write the question or not. You don't have to. But yeah. Okay. All right. So this one is a select all question. A little bit of reading on this one. So we'll say like a minute on the clock. Okay. Next question. Now, there are plenty of different possibilities here. I'm just looking for two. Feel free to list more if you want. We'll go 30 seconds for this one. All right. Let's go 30 seconds for this one. Just one correct answer on this one. I inhaled the water wrong. I'm sorry. I'm trying to mute myself in between the coughing. All right. So this one, there's one keyword I'm looking for. There's one keyword in order to get it. So we'll say 30 seconds. Okay. All right. So this one here, 3 blanks because there are 3 answers. Okay. We'll say a minute for this one here. Three answers. Next question. This is a select all. Because you got to go through each option here, we'll say 1 minute for this one. Next question. So this one here, there's 4 parts, i.e. there's going to be 4 answers. So a little bit of writing here. So we'll say 1 minute for this one. i.e. I'm looking for what could cause a first degree, what would cause a second degree, etc. Next question. This one, there's one correct answer. One correct answer will say 30 seconds. Next question. This one here, we'll say 30 seconds. All right. Next question. This one here, two parts to it. I'm looking for a location and then four things. So a little bit of writing on this one, we'll say 1 minute. So this one's kind of like a four-parter, looking for a hormone, and then how does it affect the urine? I'm looking for another hormone, and how does that affect the urine? So a little bit of writing here. We'll say 1 minute. You can say things like diluting the urine, concentrating the urine, increasing this electrolyte in the urine, decreasing this electrolyte in the urine, etc. Okay. So this one here, I'm looking for an explanation, but because you have a scrap sheet of paper, a drawing probably would be a little bit easier, a little less writing. We'll say minute 30 for this one, just because it's a little bit more involved. Okay. Next question. All right, so you can either list them out or you can draw them out, whatever's easier. Looking for 4 pressures and then an increase in which ones would cause edema. So 4 pressures, and then I'll tell you there's 2 forces. If you increase them, that'll cause edema. It's a little bit more of a thinker here, so we'll say a minute 30. Okay. All right, so this one here, lots of reading, but there's only one correct answer. So we'll say a minute because it has a little bit of reading to it. Next question. All right. This one here, we'll say 1 minute. This one can be kind of tricky. Okay. Next question. All right. 4 blanks, i.e. there's 4 answers for this one. So we'll say 1 minute. Okay. Another select all here. A few more options. So we'll say like 1:30. Next question. All right, 5 blanks because there's 5 answers here. We'll say 1 minute for this one, just because you can use abbreviations. 5 blanks, 5 answers. Next question. So I'm looking for 3 categories. And then in each category, there's 3 cells. Okay, so we'll say a minute 30 for this one because a little bit more writing on this. 3 categories, and in each category, there are 3 cells. Okay, next question. 2 categories, 6 cells in total. 2 categories and 6 cells. We'll say 1 minute for this. All right. So we are officially halfway. How are we feeling? Getting most of the questions, some of the questions, get me out. Well, Lita, you know, you can always bail. It's totally fine. I don't recommend it, but you know, you can. How's the endocrine stuff? Complicated? A little bit? Okay. And that's what I'm saying, like, you know, we're gonna go through all of the answers together. That way you guys can, we can flesh out kind of like the logic there. But I say let's take a little break, run around a little bit because we still have half of this left and I need my coffee. So let's say like 10 minutes. So 9:30, we're going to pick back up again. Okay. Oh. So what's the first thing you guys are gonna do when you're on break? Get drunk, get drunk, get wrecked. Yeah, give your brain a second. Absolutely. Hood rat shit. Oh my gosh. Yes, absolutely. I'm telling you guys, the first thing I'm gonna do Friday, I'm going to sleep. You gotta have sleep before you do stupid shit. So that's just my recommendation. All right, you guys ready to pick this back up? Last half? All right. All right, so 2 questions in this one. Oh, hey, that's awesome. Congrats, Lita. I'm still debating on if I should actually wear the attire for graduation. Like, I look terrible in a dress. I don't know. Greg, is that a pipe, sir? Sir Greg? No. Oh. Interesting. Awesome. Sorry, I'm totally like squirrel brained. Yes, a minute for this one. No, Lita, I really don't. Like, there's one time I wore a dress and it was a mini skirt. Oh, never again. Never again. The hard part was trying to find heels that would freaking fit. I got like stupid Bigfoot. Gotcha, Greg. Greg's huffing glue. Should have stuck with the pipe. Yeah, it was really fun. One of my friends, she was a store manager of one of the grocery stores in Boulder, and they had drag queen bingo. So that's the impetus there. All right, next question. All right, this one's a little bit longer. So there's 3 bullet points for each one. I would say use bullet point 1 and 2 to talk about the differences, and then bullet point 3 for the treatment. Okay, so what makes a benign tumor a benign tumor? What makes a benign tumor a benign tumor? And then how do you treat it? Same thing with malignant. We'll say minute on this one. Okay. Oh, everybody's favorite. 4 blanks, 4 answers. We'll say a minute 30 for this one. Next question. Select all. I don't know, nothing too crazy though. So we'll say maybe 30 seconds for this one. All right. All right, so this one's a little bit longer. Looking for the definition and then the 6 hallmarks. You don't need to explain them. You can just kind of use your own words if you want. You don't actually have to get the word for each hallmark here. But because I'm looking for a definition and 6 parts to it, a little bit longer, we'll say minute 30. All right. Okay, so this one here, 3 blanks. I'm looking for hyper or hypo for each one, and then a possible side effect from that. So a little bit longer on this one. Yeah, we'll say 1 minute 30 on this one as well. So again, I'm looking for hyper, hypo, and then the effect. Four blanks on this one, so 4 answers. Let's say a minute for this one. All right. So 3 parts to this question. Okay, 3 parts. 1 cell, 1 chemical, 2 effects. We'll say a minute for this one. Next question. All right, multiple answers here, but there's only 1 correct answer. So we'll say 30 seconds for this one. There's only 1 correct answer. Okay. So this one's a little bit more reading. How about we do 1 minute? Next question. 4 options, but there is only 1 correct option. Only one of these is correct. Okay. Next question. So kind of 3 parts to this question. You can kind of combine the second and third point here, but let's say 1 minute 30 for this one. So select all here, multiple correct answers, a little bit of pondering. So we'll say 1 minute. Okay. Throwback here. We'll say 1 minute 30 for this one. That's not fair. I'll say 2 minutes. You got to remember your ranges. This one here, say 1 minute. So I'm just looking for an example. You don't need to explain it, just list it out. Say 1 minute. Feel free to get as detailed as you want on this one. We'll say 1 minute. Next question. Multiple options here, but there's only one correct answer. There's only one correct answer. So we'll say 30 seconds. This one here, again, you can actually probably go into a good amount of detail here. So we'll say like 1 minute. And the final question. Say 1 minute. And if any of you get this wrong, it's going to hurt me on the inside. Okay. All right, so that is the last of the practice exam. How are we feeling? What are some initial gut reactions? Like, oh dear God, is this thing tomorrow? I feel okay. What the hell did we learn?
I like that I know what I need to focus on more tonight.
Good, good.
I feel like that feels helpful because there were some things I felt good about and other things I was like, apricot.
Yeah. No, nectarine. Nice try. All right, so far, is it feeling kind of helpful as well as that? Well, is that ultimately like that's what I'm trying to shoot for? So I just want to make sure it's feeling okay. We're gonna go through the answers and everything like that, and kind of slow me down, and then yeah. So let's take a little break, shake it out, get some coffee, come back, talk about these things. Some of these questions, obviously, I'm just going to kind of blow through super quick. So after we do our exam breakdown, and then we'll talk about kind of core, or we'll talk about Proctor U, and then we'll talk about quarter two. So like 10:10, we'll pick back up again. It's weird. Sorry, I have no idea why I'm having technical issues with my tablet at the moment. We'll just do that. Okie dokie. So let's kind of roll through these here. If I'm going too fast or you need me to re-explain anything, just let me know. Okay. All right. Question number 1, symptoms of kind of more leans towards type 1 rather than type 2. So i.e. what symptoms is a type 1 diabetic more likely to experience? Hypoglycemia. Why would a type 1 diabetic experience hypoglycemia but not a type 2?
Because type 2 don't produce insulin.
Correct. Type 2 doesn't produce insulin. What else? Think about treatment. What's the difference between the treatment of type 1 versus type 2?
You give insulin and when you don't.
With type 1, they're the ones that typically get insulin. Okay, type 2, not so much. Again, for emergency situations, sure, but for our purposes, type 1, they're the only ones getting insulin. Okay, and then DKA. Why is a type 1 diabetic more likely to get DKA than a type 2?
No glucose metabolism.
Perfect. So if they can't metabolize glucose, the only thing they can metabolize are going to be fats and proteins. Okay, questions on this one? Cool. All right, 2 possible symptoms that somebody with Graves would exhibit. Ooh. So with Graves' disease, is that hyper or hypothyroidism?
Hyper.
Correct. So I'm just looking for symptoms of hyperthyroidism. What'd you guys end up getting?
I put tachycardia and exophthalmos.
Perfect. What else?
Goiter,
Nice. What else?
weight loss,
Say again? Oh, weight loss. Yeah. Anyone else have different answers?
I
Or
put
other answers?
diaphoresis.
Nice. I'm going to say sweating because I can't spell that. Any other answers people wanted to check? Increased temp. Increased respiratory rate. Increased afterload. Increased blood pressure. Cool. All right, so why does someone have a hard time healing wounds with poorly controlled diabetes? Correct answer is arteriosclerosis. Question I have for you guys is why? How does arteriosclerosis impair wound healing?
Because your blood vessels are hardening, so it decreases blood flow to the area.
Nice. Decreased perfusion to area. Perfect. Diabetic neuropathy, that affects your feeling of a wound, doesn't really affect wound healing. Poor diet, sure, that can kind of contribute there. I would say arteriosclerosis is going to be the bigger factor between poor diet and arterio. Impaired insulin release doesn't really apply to diabetics. It's the issue of insulin action for type 2 diabetics. And then decreased clotting factors, diabetes doesn't affect clotting factors. Okay. So how does a person develop Hashimoto's? Keyword I was looking here was autoimmune. I have to mention something that it's an autoimmune disorder. This one specifically attacking their thyroid. All right. So me living my life talking about stress. So what hormones do you expect to see with elevated stress? I'm pretty sure everyone got cortisol, yeah? How do you get cortisol?
From your gluco, I don't remember what the full.
It is a glucocorticoid, correct? How do I release more cortisol? How do I release more glucocorticoids?
Don't you need CRH to release it?
You need CRH at the hypothalamus, which then goes to ACTH at the ant pit. Then you get more cortisol at the adrenal cortex. So the reason why I bring this one up here, if you're going to have more cortisol, it has to come from somewhere. Okay, so this is the pathway. If I'm stressed out, I release CRH, which then goes to trigger release of ACTH. Then I finally get cortisol. So just heads up about that pathway. Okay.
Just checking if we would have just put like, not just, but like instead of glucocorticoids, would cortisol have been just enough, or do you want both?
That it's probably going to be more of a multiple choice answer. And honestly, if I asked you something like this, so you'll see most likely cortisol. Yeah.
Okay.
All right. Select all. Plot twist, all of them. What? So I won't do this on the exam. That's mean. But like I said, I was trying to make this a little bit more stressful than usual. Okay. So hypersecretion of PTH. Question for you. How does that lead to osteoporosis?
Because it stimulates osteoclasts.
Nice. Stimulates your osteoclasts. Absolutely. Hyposecretion of calcitonin. So remember, calcitonin is the antagonist to PTH. So this would inhibit, this would inhibit your osteoblasts and also lead to, again, really active osteoclasts. Okay, so A and B are actually kind of the same. How would hypothyroidism contribute to osteoporosis?
No calcitonin.
Perfect. If you have hypothyroidism, that leads to all decreased thyroid secretions. So that's going to decrease calcitonin. So actually B and C are kind of the same thing. Okay. PRH, prolactin releasing secretion. You're increasing breast milk. That calcium is going right into the breast milk, right? Prolactinoma, what's going on there?
It's a tumor.
It's a tumor. Wow. It's not a tumor. But yeah, it's a tumor causing me to release what?
Prolactin.
Mm-hmm. So in essence, these are the same thing too. Hypersecretion of somatostatin. Oh, that's weird. What does somatostatin inhibit?
Growth hormone and TSH.
Nice. It's that decrease in TSH, decrease in thyroid stimulating hormone. So, hey, guess what? Your thyroid's going to be underperforming. Leading us right back to that. Okay. Questions on this one? Kind of tricky. All right. So burns. First degree, what'd you guys get?
Sunburn.
Perfect. I'm saying UV exposure. You can do sunburn, that's fine. Second degree.
Quick heat.
Nice. So you can do heat, you can do fire, you can also do UV if you want, that's fine. Okay. Third degree, what'd you guys get?
Chemical,
Nice. Okay, and fourth degree?
Electrical.
Yep. Okay. All right, primary risk factor for CAD. Ugh, CAD acronyms. Coronary arterial disease. Coronary arterial disease. So coronary arterial disease affects what organ?
The heart.
The heart, because of your coronary arteries. Absolutely. So it's heart disease. Primary risk factor for heart disease, atherosclerosis, right? Because athero causes coronary artery disease, can cause cerebral vascular disease, or peripheral arterial disease. Of these three, coronary artery disease is going to be the most common. Okay. So atherosclerosis is most likely going to affect your heart. All right. Lab test for extended period of time measuring blood glucose levels, HbA1c. Pretty straightforward on that one, yeah. Does anybody remember what the hemoglobin A1c test actually measures?
Isn't it crystallized?
Mhm.
I don't remember.
Yeah, you're good. It's
Why?
crystallized hemoglobin. So looking at the proteins on your red blood cell there. Perfect. All right. Where does the majority of, keyword here was secretion, happen? DCT, distal convoluted tubule. Four things: potassium, protons, ammonia, and urea. Okay. So filtration. So just a little bit of a recap here. Filtration, where does that happen?
Glomerulus.
Perfect. Glomerulus. And what are the four things that we filter?
Electrolytes. Water.
Mm-hmm, mm-hmm.
I know this.
Glucose.
Glucose,
And amino acids.
amino acids, nice. The other thing, I guess, that we kind of added on there was creatinine. Reabsorption. Where does the majority of reabsorption happen?
The PCT.
Perfect. PCT and pretty much the top four. So water, electrolytes, glucose, amino acids. In diabetics, what is impaired during reabsorption? I.e., diabetics have a hard time reabsorbing what?
Glucose.
Glucose. That's why the glucose is in the urine. Very good. All right. Name 2 hormones and how they affect the nephron. So I chose ADH, antidiuretic hormone. Antidiuretic hormone means you reabsorb more water into your blood, thereby concentrating your urine. Okay. Aldosterone was the other one. With aldosterone, you have sodium and water reabsorption. So, hey, you pee less. Okay. Also causes this potassium secretion. So you'll see more potassium in the urine. Natriuretic peptide, you pee out sodium, you also pee out water, therefore increased urine output. Okay, so i.e., you can look at this one as, I can ask you, how does it affect the urine? But also I can flip and ask you, how does that affect the blood? Okay, ADH and aldosterone, how does that affect your blood?
It increases blood volume,
Increases blood volume, thereby increasing blood.
pressure.
You got it both ways. So you can say increased blood volume or increased blood pressure. That's totally fine. What would natriuretic peptide do to your blood?
It decreases the volume, therefore decreasing blood pressure.
You got it. Decreased volume, decreased pressure. Very good. All right. So how does a person get Graves' disease? Let's start off with, what kind of disease is Graves' disease?
Hyperthyroidism.
It is hyperthyroidism. Okay. And think of it in terms of hypersensitivity. What kind of hypersensitivity is Graves' disease?
Type 2.
Nice. It's a type 2 hypersensitivity, i.e. autoimmune. Okay. So with Graves' disease, we start with TRH, TSH, T3, T4. That will inhibit those two things. Now with Graves' disease, what are the 2 kind of blood values? Think about, like, in the blood, what hormones are elevated in the blood?
T3 and T4.
Awesome. And second part is, this makes Graves unique. What is minimalized in the blood? What is minimal?
Is it TRH and THS? TSH?
Okay. What causes the elevated T3, T4?
Overactive
Yeah.
thyroid.
It's definitely going to be an overactive thyroid. Via what?
An autoimmune attack on the
Not so much an
receptor.
attack. 3 letters. Yeah, there we go. Via TSIs. These are your antibodies, the immunoglobulins. They go, thyroid stimulating immunoglobulins, they go and stimulate your thyroid. Absolutely. What about the minimal TRH, TSH? What's going on there?
Is it because the negative feedback loop is damaged somehow?
We have an autoimmune attack on T3, T4 receptors at the anterior pituitary. So that means there's a wall right here. Therefore, T3, T4 can no longer shut off TSH, but we can shut off TRH. We shut off TRH, that's also going to shut off TSH. Okay. All right, so list or draw the 4 pressures. I'll probably end up drawing them, just it's a little bit easier. You got cap hydro, capillary oncotic, cap hydro pushes out, cap ionic pulls in. And then you got the interstitial hydro, interstitial oncotic, going the opposite direction and much smaller. So the second part, i.e. if we increase which pressures to cause edema. Okay. Which pressures, if I increase them, would cause edema?
Cap oncotic.
If I increase capillary oncotic, so this is what it looks like now. If I increase this, I would have more water going into my blood vessel. Would that cause edema? No. Edema is defined as fluid outside of the blood vessel. So which pressures are moving fluid out of the blood vessel?
Cap
Hydro and interstitial oncotic.
Nice. Cap hydro. So if I increase this one here, that means I would have more water out here. I agree. And interstitial oncotic. Again, only because these two, ooh, that didn't work out. These two pressures are the only ones moving water out of the blood vessel. Okay. I drew those a little too close. Questions on this one? All right. So B12 and folate, what do they do for erythrocytes? Let's start with that first part.
give them lifespan.
Give lifespan, perfect. So here's a pro test taking tip here. Give lifespan, we know that's the correct answer. We're going through these. Do you really even need to read the rest of the questions? No, okay. But if you wanted to, anemia results from either vitamin deficiency, it's going to be macronormoanemia, because with the lack of B12, you're looking at pernicious anemia, folate deficiency anemia. You need B12 and folate to make DNA. The DNA is wrong, the cell's going to be way too big. All right, so this one's a little tricky here. A male with pheochromocytoma. First off, what is pheochromocytoma?
Isn't it a tumor on your adrenal medulla?
tumor at the adrenal medulla. Nice. Now, if I have a tumor on my adrenal medulla, what am I secreting too much of?
Epi and norepi.
Mhm. So, prolonged fight or flight. Throwing male in there, does that matter? Male, female, child, adult? No. So what I'm getting at here is you kind of really have to know which ones affect male versus female, child versus adult. The only time we really kind of talked about it was growth hormone, child versus adult was a little bit differently. And then we talked about virilization and feminization with DHEA. Okay. So the male is a bit of a red herring, throws you off your game if you don't know what pheochromocytoma is. Yeah. All right, 4 ways to stimulate large A's, i.e. gate control theory, temperature, vibration, pressure, and the new one we learned about in the last lecture was scratching. Okay, so 4 total there. All right, so a tumor on which endocrine organ would lead to hypertension? All right, so this is a good little way to kind of review. Well, if I have a tumor on my anterior pituitary, we secrete more hormones. Which hormone would cause me to have hypertension from the anterior pituitary?
Antidiuretic.
That is going to be posterior pituitary. Close. What about anterior?
Growth hormone.
Growth hormone can do it. Or
3 T4.
eventually T3, T4, because from the ant pit we get TSH, which would then lead to T3, T4. Okay. Thyroid. What hormone for my thyroid would increase blood pressure?
T3.
T3. I'm going to say T3, T4 because they're usually tied together, but T3 is perfect. Adrenal cortex. Which hormone from the adrenal cortex would increase blood pressure?
Cortisol.
No, not quite.
Aldosterone.
Aldosterone. But usually when you're stressed, your blood pressure goes up as well. Chromaffin cells. What comes from your chromaffin cells that would increase blood pressure?
Epi and norepi.
Nice. Epi / norepi. So again, keep in mind adrenal medulla, pheochromocytes, and chromaffin cells. 3 different names for the same thing. Okay, so it could be chromaffin cells there, it could be pheochromocytes, or it could be your adrenal medulla. Parathyroid affects bone. The pineal gland secretes melatonin. What does melatonin affect?
Isn't it your biological clock?
Yeah, your biological clock or your circadian rhythms. Perfect. Okay, so atherosclerosis, we kind of already talked about this one here. Athero can lead to CAD, or it can lead to CVD, lead to PAD. Those are the diseases. An MI is an event. CVA, stroke, is an event. Nothing for PAD. Of these diseases and events, which one is most likely going to happen with atherosclerosis?
CAD.
Perfect. Most Alrighty. Okay. All right, so the innate cells. First category here was Ben. These are your granulocytes. What does your granulocytes do? What do they contain?
Grains of histamine.
Grains of histamine, perfect. Men, these are your diapedetic. What do diapedetic cells do?
They can travel.
They can travel, perfect. Ped, foot, travel, i.e. they can squeeze in and out of blood vessels. Damn. Those are your phagocytes. And what do your phagocytes do?
They eat.
Eat, perfect. All right, for your adaptive cells here, B cells, you got your B plasma. What do your B plasma cells do?
They make antibodies.
Nice, antibodies. B memory cells, remember. T helper cells, these are your coordinators. T suppressor, this is going to regulate tolerance. T cytotoxic, cell poisonous, their job is to kill infected cells. And then T memory, their job is to remember. So a little bit of a crash course there.
Are T suppressor also T regulator?
Yeah, sorry.
No, it's okay. I was like, I don't know what that is.
Yeah, you're correct. T suppressors are also known as T regulator. I think I use T regulator more often this quarter. Sorry. Okay. So then what electrolyte is skeletal muscle most sensitive to? It's going to be calcium. Okay. Because calcium affects which part of the neuron, which property of the neuron?
Threshold.
The threshold, perfect. Okay. And what modulates the resting?
Potassium.
Potassium, perfect. Okay. What skeletal muscle must not become impaired? Diaphragm. Okay, the diaphragm getting impaired means you can't pull on your lungs, you can't breathe. Anybody remember what disorder? There's a couple we talked about, but what disorder is going to eventually paralyze the diaphragm?
Is it MS?
Not quite MS.
ARDS.
ALS.
ARDS. Yeah, perfect. You guys nailed it. You can be ALS or somebody has ARDS. I guess ARDS is kind of less. Okay. So your diaphragm getting impaired, two main places. ALS, where we have ascending paralysis, hits the diaphragm, I can't breathe. ARDS, it's when you're basically tiring out. Your lungs are filling with fluid, you're gasping for air, but then your diaphragm runs out of energy, can't contract anymore, can't inhale. Okay. All right, differences between benign and malignant. A couple of them, keywords with benign, I was looking for something about being encapsulated or not moving. You can say compartmentalized, that's fine. Other difference here, it's a low metabolism, i.e. slower growth rate. Treatment, surgery, usually if we can get it out. Okay. With malignant, keywords I'm looking for is something about invasive. Okay. High metabolic rate, so fast growth. If you said something about metastasis, that would be fine. Treatments, the Trinity, surgery, radiation, chemo. Any other differences people got?
I just mentioned the basement membrane being broken or not broken between the
Totally
two.
fine. That would be good.
Oh, I have a question.
Mhm.
So for both benign and malignant, they're both dysplastic cells, right?
Correct.
And then what's the difference? I would just remember, I'm thinking back to that lecture. What did you say
Mhm.
about the difference between that though?
Right. So benign, so that correct, they're both dysplastic, but on a spectrum, malignant is even more dysplastic. So you can kind of think of it as maybe I would say benign are dysplastic cells, and then malignant are interrupting dysplastic cells, i.e. they're going to interrupt other functions, other cells. Mhm. All right, how does the liver contribute to hemostasis, i.e. how does the liver help you stop bleeding? These four here: vitamin K into prothrombin, clotting factors, TPO, that hormone for platelets, plasminogen turns into plasmin to break up clots. Okay. Yes. Sorry, she's in her rebellious phase. All right. What kind of exercises are most beneficial for maintaining bone density? Walking on a treadmill, weightlifting, martial arts. Sorry about underwater basket weaving if you chose that one. What do these three things have in common?
They're weight bearing?
Weight bearing and
Impact.
yeah, impact. Okay. All right. 6 hallmarks of cancer. With the definition of cancer, we're looking for uncontrolled dysplasia. Absolutely. We're also going to see cell invasion, uncontrolled dysplasia, cell invasion, and unregulated. So when it comes to the definition, 3 kind of parts to it: uncontrolled, unregulated, cell invasion, or dysplasia. 6 hallmarks there. That's kind of like straight out of your notes. I don't know. You guys cool if we just kind of blow past it?
Can I just ask one question?
Please.
When I was studying, I was trying to figure out if we had a like more in-depth way of evading apoptosis other than like obviously it inhibits P53, but like do we know how? Like is that something we're supposed to know how it's like inhibits P53 or just know that?
It's going to inhibit BCL2. BCL2 is a set of genes that controls for apoptosis. So just like with P53 getting knocked out, BCL2 gets knocked out as well. Mhm.
Okay, thank you.
Great question. All right, so what happens to electrolyte concentrations when somebody with diabetes insipidus? Again, remember the key here is I'm going to be asking you questions about diabetes insipidus, like expect a few. Okay. What is diabetes insipidus? Anybody remember?
It's too little antidiuretic hormone.
Beautiful. So just keep in mind, diabetes insipidus is different from diabetes mellitus, yeah? Okay, so I do not have enough antidiuretic hormone, i.e., how does that affect my life? if I don't have antidiuretic hormone?
You're peeing a lot.
I'm peeing out all this water. Absolutely. So what's happening to the things in my blood? If you have no water left in your blood,
Your blood would be super thick.
your blood would be super thick. Yeah, absolutely. And super concentrated. That's why we call it diabetes. Because the concentration of things are going to go up. Sodium is going to go up. Hyperkalemia, hypercalcemia. You would also see hyperglycemia. Everything becomes more concentrated in the blood. That's why we call it diabetes. Okay. So, issue with hypernatremia, you get a little dehydrated. Hyperkalemia, bigger problem here because, hey, that's going to affect your heart. Hypercalcemia makes your skeletal muscles more weak because that threshold's going up. Questions on this one? Kind of a trick here. It seemed like, one would go up, the other one would go down. All of them go up. Okay. What was the disease that was opposite to diabetes insipidus? What was the disease called that was opposite to diabetes insipidus, i.e. someone had too much antidiuretic hormone?
Syndrome of inappropriate antidiuretic hormone.
Perfect. Yep. SIADH. Perfect. 4 steps in the pain pathway. So transduction, that's basically activating your nerves. Transmission is where we go from the peripheral nervous system to the central nervous system. Perception, this is now when you are aware that you're in pain. And modulation is your attempt to control or decrease pain. Okay, so 4 steps there. Just heads up, this is like the second pathway, or yeah, week 2 of farm. You jump right into this. Okay. Pathologies, i.e., what diseases do people have with inappropriate pain? Okay, hyperalgesia was one that we mentioned. Hyperalgesia, this means you're kind of built up a tolerance to pain medications. So take, for example, opiates. If I take opiates every day for my back pain, my body raises my sensitivity so that way I can feel things again. That means I need more opiates because the pain's going to come back. Chronic pain. Is that a useful type of pain? No, I am not better off by having chronic pain. Okay. Neuropathic pain. So we kind of saw that with diabetes mellitus. Hey, is it good that if a person can't feel their feet? No, that's a pathological issue with pain. Allodynia, this is where you feel pain from non-painful stimuli. So clothing feel like fire, wind can feel like ice, like cuts on your face, etc. Okay. All right, what cells are responsible for initiating inflammation? Mast cells. Mast cells, they started off, mast cells are your local fire alarm, right? Are they blood cells? No. Why? Why are mast cells not considered blood cells?
They're stationary?
They are stationary, perfect. They release that histamine, 2 effects, vasodilation, increased capillary permeability. That's not a 2, I can't count. Okay. All right. What is a patho example of an immune complex mediated hypersensitivity? Let's So this here is vocabulary, okay? So we know that it's a hypersensitivity. How many different types of hypersensitivities are there? 4, perfect. Immune complex. An immune complex means we have an antibody bound to an antigen. Okay, so I'm basically saying, hey, use this as an opportunity, run through your hypersensitivities. You saw them pop up all quarter long. Hypersensitivity 1. Anybody remember anything about hypersensitivity 1? What kind of reactions were those?
Allergy.
Allergy, anaphylaxis, perfect. Hypersensitivity 2, what kind of diseases encapsulated hypersensitivity 2?
Autoimmune.
Autoimmune, perfect. So it's not 1 or 2. This is a type 3. Okay, this is basically that marker with the cap attached to it. Then it's improperly disposed. It gets stuck somewhere. Okay, so that's why glomerulonephritis is the correct answer here. Again, that was when somebody had strep. We tagged the virus with the antibody and it gets stuck in my kidney. I need to destroy my glomerulus to free it, causing inflammation. Okay. All right, so where do we find peptic ulcers? Typically the duodenum because of H. pylori. Yeah, I got some celebrating to do. All right, which pressure increases during a tension pneumothorax? So a little bit of a recap here. If I have a tension pneumothorax, what did I get stabbed with?
A knife.
A knife, perfect. I get stabbed with a knife and that creates a one-way valve. That means more air is allowed in, but no air is allowed out. Therefore, which one increases during a tension pneumothorax?
PIP goes positive.
Perfect. PIP goes positive. So this is the example with the goat lung in the bag, right? The bag started inflating more and more. Okay, Conn's disease. Oh dear God, what was Conn's disease? This is what I'm saying, like, be careful on the exam because sometimes I'll tell you like, hey, this is hyperaldosteronism. Sometimes I won't. So there are some that follow Latin, right? Hyperthyroidism, but Graves doesn't. So Conn's, Addison's, Cushing's, SIADH, diabetes insipidus, some of them don't follow the Latin. So just be careful about that. Probably have those. Okay. So Conn's disease is too much aldosterone. How does this affect the patient? So, hey, you have too much aldosterone, you increase sodium and water reabsorption, potassium secretion. So you're reabsorbing sodium and you're reabsorbing water. Therefore, does somebody with Conn's disease have a sodium imbalance? Why not?
Equal concentrations are reabsorbed.
Perfect. Yep, you're taking 1 sodium, 1 water, equal concentrations. Beautiful. So therefore, the big issue there is that leading to hypokalemia. So what organ is at risk with a patient with Conn's disease?
The heart.
Perfect. All right. What conditions most likely lead to COPD? This one's kind of superficial. Chronic bronchitis and emphysema. Those are the 2 big ones. All right. So, hey, you guys remember when I told you about ABGs? They're kind of important. In fact, I've had other quarters past Q1 come back and say, hey, do you have that video where you taught us ABGs? Because it's back. I'd probably know them. If you remember way back when we started this here, mentioned that there was a few cumulative short answer, fill in the blank kind of things. So, hey, know your ranges. So starting off with ranges, pH. What is my range for pH?
7.35 to 7.45.
Nice. Right in the middle, 7.40. CO2, what is my range for CO2?
35 to 45.
35 to 45. But with CO2, what do we need to do in particular?
It's backwards. It's 45 to 35.
Why?
Because CO2 is acidic.
CO2 is acidic. The more CO2 you have, the more acidic you are. Very good. And bicarbonate. Anybody remember bicarbonate? What was the range there?
22 to 26.
Nice. Nice. Good work, guys. So sorting it out here. All right, so pH 7.25, so that's going to go right about meow. CO2 is right about meow. And bicarbonate is right about meow. So respiratory acidosis with partial comp. Agree, disagree? Now, why is it partial comp and not full compensation?
Because pH isn't normal.
pH isn't normal. It's not within range. I'm still dying. Very good. So, hey, know these. They're going to show up. They show up in foundations. You get like 10 minutes to recap this, and then you're going to have exam. That's the way I remember it. So just keep these in mind, yeah? All right. What triggers the intrinsic coagulation cascade? It's that collagen damaging the inner layer of the blood vessel. The one we usually associated with it was atherosclerosis. All right, provide an example of an inflammatory joint disorder. What'd you guys get?
Rheumatoid arthritis.
Nice. Anybody else?
Gout.
Nice. I'll take gout. Ankylosing spondylitis. Okay, so that was the third one there. That was with the back fusing, where we attack the vertebral discs and the spine begins to fuse. All right, compression socks. Prevent deep vein thromboses. So you can say prevent blood clots, that's fine. Venous stasis ulcers, helps prevent venous stasis ulcers. Helps prevent varicose veins. And you know, it might not be bikini season, but I like to have a little bit of confidence underneath my scrubs, just saying. All right, hypertension, most common, right? Like 95% of people have primary hypertension, primary unknown. Salty bananas are disgusting. And hey, potassium is going to affect cardiac before skeletal. Sodium has no effect. So if somebody did have a muscle cramp, what would be a better recommendation?
Milk.
Well, he needs his milk. Oh boy. Ischemia, hypoxia, necrosis. What pathologies did you guys come up with that we covered this quarter or in life that follow this?
I put arterial sclerosis.
Perfect. What else?
Hernias.
Hernias. Yep. Oh, come on, there's plenty of diseases. What else you guys get?
I said like venous stasis, but I don't know if that's right.
Yeah, absolutely. Venous stasis, ulcers. What else? Talking about ulcers.
Pressure ulcers.
Decubitus ulcers or pressure ulcers. Yeah, sure. Oh God, what else? Now you can have a fat clot block your heart, but what is it called if it blocks somewhere in your brain?
A stroke.
Yeah, stroke, CVA. Uh-huh. What else?
DVT.
Nice, DVT, deep vein thromboses. Okay, how about everybody's favorite? ARDS will do it. Hey, you can't breathe. What else?
Diabetic neuropathy.
Nice. Yeah. Nice. Diabetic neuro.
PAD.
Nice. PAD. Absolutely. What was that? Smokers, we get it all the time. You guys saw like 3 necrosed fingers. It was like a blood clot with inflammatory factors.
Brokers.
Waggers. Thrombo, angiitis, obliterans, or Boeggers. Okay. And the list goes on, but just saying like, hey, we've talked about a lot of disorders, yeah. That is it. That is it, my little grasshoppers. I have taught you all I know. So tomorrow you guys have your final. For me, it's in person, still on Canvas. I'm not doing like ProctorU. I really don't even want to touch it with a 9-foot pole. I hate ProctorU. It's just so needlessly anxiety driving. Ugh. All right, so some ProctorU tips for you. Okay, first up, run the PC check. Okay, make sure that your PC is compliant. Just make sure that like it's not giving you some stupid random error code like, oh, it's not compatible with Chromebook or something like that. Okay, just make sure you do that sooner rather than later. Megan, this is just to help you out for health assessment for when you do need ProctorU. I think like this is my way of trying to reduce anxiety because you guys have never taken a HESI yet, right? So run a PC check, get the browser extension. Okay, so if you just type in like ProctorU Chrome extension or Firefox extension, it makes your lives a little bit easier. It makes it a little bit more compatible. Oh, by God, set a motherfucking timer. Okay, so here's something that nobody fucking told me. When you jump into ProctorU and you get into your HESI, there's no timer. You guys know in Canvas, you're taking your exam, you see the timer, it can be anxiety driving, sure. For me, I freak out and I don't know how much time I have left. So then I start speeding up and I'm like, oh, wow, I did my HESI in 18 minutes and I failed. Great. On your watch, on your clock, I don't know, set a timer so you know exactly how much time you have left. Okay. I don't remember the time you guys have for HESI. I think it's like 75 minutes, but I could be wrong. I think it'll tell you like 65 minutes before you start or something like that. Set a timer just so that way you know where you're at. I'm gonna be honest with you guys, the health assessment HESI, I got done in like 20 minutes. It's real quick. It's not bad. Honestly, like I told you guys before, Lindsay's exams are just so much more stressful than the actual HESI itself. The HESI scales, right? The more questions you get right, the harder the questions get. So if you have like 2 or 3 select alls in a row, you're doing great. And it's weird, like you can miss a question and not even have it count towards your overall grade. Like there's no way I actually answered 99.99% of those questions correctly, but that's the score I got. Yeah, I like there's so many issues I have with the whole HESI and ProctorU and all of that. It's weird.
Isn't that how the NCLEX is set up though? It starts to modify itself based off of what questions you're getting wrong or right.
Yes and no. Yes and no. From my understanding now, I haven't taken the NCLEX, so I can't tell you, right? But they're also remodeling the NCLEX a little bit more to be kind of more application-based rather than theory-based. So they're going to be basically, you're going to see like a case study, this patient, this paragraph, and then you're going to have like 7 questions about that patient. Not necessarily that, you know, they're going to make those questions harder for that specific patient, but if you get them all right, then you'll probably have a harder patient. Trying to think about other things. Okay, your ProctorU is supposed to be recorded. It's not like someone's actually watching you most of the time. Now, there are a couple nightmare situations. I would say of my HESIs, I had no idea if anybody was actually watching me. It's just recorded. You gotta have your camera on. Oh, you need your ID. Get your ID, like driver's license, because like you have to hold it up to the camera to take a photo. I didn't know if anybody was actually watching me or not. I just know that they record it. However, in some rare instances, there's going to be a live proctor. So when I was taking health assessment, out of 3 cohorts, 1 girl got a live proctor, and this live proctor was invasive, to say the most, or to say the least. Proctor, starts communicating with the student. I need to see your desk. I need to see under your desk. I need to see your walls. I need to see behind you. There was, I don't know, a rumor, I haven't confirmed it or anything like that, but there was a rumor about another student who had a very invasive proctor that said, you have to get a mirror behind you. So I'm like, why? You're recording the screen. You're not going to be able to see somebody's freaking mirror behind them if they're like cheating. Get set up early, make sure everything's running. The timer works weird. I would say just be ready minimum 15 minutes before your exam. Okay, you can see that timer countdown, but then just jump on it. Personally, for me, for proof, I take a photo with my phone on when I'm done. It'll tell you your HESI score and percentage of that. I take a photo of that just in case they lose your exam or something like that. Like, hey, you have proof that you actually did it. Yeah, questions about ProctorU and that nightmare? All right, so quarter 2 tips. All right, first thing, y'all, you need to celebrate after the end of the quarter, okay? The end of this quarter, this is the end of your first quarter in nursing school. Celebrate because quarter 2 is rough. I'm not lying to you, it's just rough. Now, what makes it so rough? You have farm on one side, and then you have foundations on the other. Okay, With farm, there's two parts to it. You'll have didactic. Oh, Lord. And then you have, it's called dosage lab. Ugh. Lab. Okay, didactic is lecture. Dosage lab, this is where you just show up and you do math problems. I'm going to tell you guys, you might be scared of math or you might be averse to math. Learn to actually like math. Why? Dosage lab was the one goddamn thing I look forward to. You know why? Because there's one answer. No matter how you make a math question, there's only one answer. 100 different ways you want to get there, fine. One answer. None of this, well, your answer is kind of correct, but then in this situation, you're wrong, or this answer is more correct than there's no gray area with math. It's therapeutic. It's nice. Learn to like it. If you need help with dosage, just let me know. I used to teach math and physics, so it's kind of my jam. But yeah, kind of use it as like your nursing meditation, if you will. With foundations, there's 4 parts to it. Didactic, Sims, clinicals, and lab kind of kicks in midway through the quarter. Okay, so realistically speaking, look at quarter 1. You had health assessment, didactic, and skills. Then you had patho. If you're counting here, you're looking at 6 different things in quarter 2. So your work is effectively going to double, if not more so. Okay. Now, working during quarter 2, the line that I'm supposed to tell you is like, hey, don't work. I genuinely say, if you can help it, try not to work during quarter 2, just because you have so many moving parts going on. Sims is 4 hours. No, 3 hours. Sorry. Sims is 3 hours. Clinicals is 12. Okay. All with their own deadlines. And then farm we'll talk about is farm. If you can help it, don't work during quarter 2. But I'm a hypocrite because clearly I'm working full time during quarter 2. So just if you can, just be careful. Make sure you understand, make sure your priorities are in the right place. And be prepared to sacrifice a lot in terms of sleep, time with friends, family, etc. It gets better after quarter 2. But I'm just saying, like, quarter 2 sucks. Okay. Clinicals, it kind of depends. Usually it's 4 weeks. Okay. So how, for me, I had virtual clinicals when I took foundation, so it's a little bit different. But for me, in MedSurg 1, what's going to happen is I teach Monday, Tuesday, Wednesday, Thursday, Friday. Saturday, I have a 12-hour shift at clinicals. And then Sunday, I have a 12-hour shift at clinicals. Monday, Tuesday. When I do this for a fucking month, it's going to suck. You guys, it probably won't be as so bad. Take, for example, if you don't have classes Monday and Tuesday, they might put your clinicals on Monday and Tuesday. That way you have class Wednesday, Thursday, Friday. So sometimes you might get weekends, sometimes you won't. Sims is 3 hours a week, correct. Okay. Now, when it comes to farm, everyone's nightmare. I'll tell you, it's not unfounded. In terms of didactic, EAQs are kind of helpful. Let me kind of put a caveat there. I liked the EAQs the first 4 weeks of farm. I found that by doing the EAQs, they were similar to the questions on the exam. Bueno. After 4 weeks, not helpful at all. It turned out to be a giant waste of time. 1 week, I ended up doing 1,200 some odd EAQs, and that was one of my worst test scores. Yeah. So EAQs, some students say they're helpful, some say they don't. I would say start with them and kind of see how that helps, but be flexible in your studying. really kind of focus on Kara's lectures. Okay, Kara's lectures make up, give or take, about 98% of the exam. Okay, there's two instructors for pharm. One is Trent, he's the other patho guy. He's going to explain to you the pharmacodynamics, i.e. what happens in the body when you take this drug, basically relates it to patho, interacts with this pathway, turns that off, boom. Kara is going to be teaching you the nursing considerations. This is digoxin. These are your typical doses. These are your adverse effects. This is who we give digoxin to. This is who we want to hold giving digoxin, okay? So focus really on Kara's lectures more than anything else. Trent's lectures, absorb it. Just absorb it, but don't focus on it, okay? Other things that I do recommend, Level Up RN. Level Up RN is a company. She has YouTube videos, but also sells flashcards. Okay. I like Level Up RN because she gives you like some nice mnemonics. So take, for example, when it comes to beta blockers, PLC, please listen carefully. You need to listen carefully when giving propranolol, labetalol, and carvedilol. Why? Because they're non-selective beta blockers. They affect the lungs too. I'm just saying Level Up RN, really good, helpful memory mnemonics. I recommend her flashcards. I wouldn't focus on the flashcards. I would use the flashcards to kind of glean the memory tricks off of there. Take, for example, one of them is digoxin. When you take digoxin, it causes your heart to dig deep, slows down heart rate, really helps you to fill your heart, increase cardiac output. So I recommend her flashcards. I had really good experience with that. But by no means would I say that's a substitute for Kara's lectures. Basically, with Kara's lectures, anything goes. Anything she has written down, anything she says can be tested on the exam. So she can test you over something that she never has on her slides. She says it verbally. Take notes, write fast. She does do screen lecture recordings, I think, as well. But it's a very different pace from what I kind of raised you guys with. Truth be told, I had no idea what I was doing in pharm until about week 6. Trying to figure out how to study and everything like that was rough. When it comes to organizing your notes, what I would recommend is your medication. Have your medication. And then for me, I need to know kind of the why, the mechanism, like why, how does this medication work? And then indications. So if somebody has an indication for a medication, indication means reason to give. So why would you ever give this person a medication? Contra indication means reason not to give, like they're allergic. That's a contraindication. Okay. Adverse effect. So this is something that they didn't really explain. There's a difference between an adverse effect and a contraindication. Okay. Adverse effect is going to be an expected abnormal response. Okay, so take, for example, let's use aspirin. Okay, aspirin, pretty common pain reliever, yeah. Okay, and it inhibits COX-2. That's a me thing, that's the mechanism. Indication, why would you ever want to give aspirin? Because they're in pain, right? Contraindication, why wouldn't you give somebody aspirin? Well, they have an allergy to it, don't do it. Adverse effect, aspirin inhibits platelets. So an adverse effect here would be excessive bleeding. You see how contraindication and adverse effects are not the same thing? They can be, but they're not, okay? and then kind of like nursing considerations. So do I want to give 3 kilograms of aspirin to a person? Oh, dear God, no. Okay, max tox level is about, I think, 2,000 milligrams a day. So that's what I would recommend when it comes to like going through the medications there, kind of sort them out that way. When you guys jump into it and you need help, hit me up. I'm still around next quarter. Okay, if you guys are struggling with farm, let me know. I will try to help. Foundations, not so much. Foundations is just a weird logic that I couldn't pick up. Full disclaimer, full transparency. I passed my farm HESIs. I did not pass my foundation HESI. So I had to do remediation. So if you need to do remediation, let me know. It's not bad.
Can I ask a
I'm still here, guys. As far as I know, I should be teaching next quarter if I'm not getting fired. So if you guys need help, you guys want to scratch my brain, you're more than welcome to it. Okay. With foundations, it's not bad. It's very similar, kind of like to CNA work. You're only working with stable people, etc. But there's a weird logic to it where context is everything. Context is everything. Yeah. Anything else I can help you guys out with in terms of knowing the future is coming down the drain pipe?
I have a question about the exams in dosage calc.
Go for it.
Do they still have it set up that you have to get 100% on the exams?
Great question. So you have weekly quizzes in dosage, but they're pass fail, i.e. if you do them, great. If you don't, you're going to fail. Just do it. Your score doesn't matter. Okay. Now at the end of dosage, you will have a dosage final. Dosage final is 15 questions. This is one thing that I hate about it. Okay. Look, guys, I'm going to be honest with you. I have a master's degree in fucking biomechanics. I love physics. I like math. I got nervous with how they kind of phrased everything because there's 15 questions and you need to get all 15 correct. You need 100% in order to pass. If you miss one question, that's an insta fail. And if you have an insta fail, that means you don't pass farm. Ha! What? Talk about pressure. Okay. When it comes to the dosage final, the math is not bad. It's basically just dimensional analysis and knowing significant zeros. It's not bad. And you get 3 attempts to it. So take, for example, if you do not pass the first time, you will have a second attempt at your dosage final to get 100%. And if that doesn't work out, it's okay. You have a third. Okay. So that's the thing there. Like, it's just so anxiety inducing knowing that like one math problem can screw all of farm, but that's not really the case because you have multiple attempts at it. So, yeah. Great question. Anything else? My little birdies. Okay, my dudes. I'm going to post, I'll try to post this lecture sooner rather than later. I'll see you all tomorrow. Boop, boop. I forgot, am I? Yeah, I'm probably gonna end up stopping at a brewery tomorrow, aren't I? Yeah, I
Might
think
just
that's
happen to see you there.
what a
Might just happen.
coincidence.